Imagine, just for a second, living with a condition where your body's own internal security system is just constantly on a hair trigger.
Right. It's always on high alert.
Exactly. But it's not fighting off a cold or like a flu. Instead, imagine it's aggressively attacking your own tissues day after day, causing this severe chronic pain in, one of the most sensitive areas of the human body. If you've ever dealt with any kind of inflammatory condition yourself, you know how incredibly exhausting that constant state of biological warfare can be.
It is deeply draining. I mean, it really is. And when that biological warfare is happening locally, specifically in the vaginal mucosa, the toll it takes on a person's quality of life is just profound.
Yeah.
We're talking about an impact that goes far, far beyond mere physical discomfort. It affects intimacy, mobility, and mental health.
It's a really heavy reality. But today, we are diving into this stack of research that points to, a truly groundbreaking frontier in women's health.
It really is.
We are looking at a condition known as chronic desquamative inflammatory vaginitis, or DIV. And more importantly, the mission of this deep dive today is to explore a radical new approach to treating it.
Yes, using these microscopic cellular messengers called exosomes.
Right, exosomes. And we're going to see how they influence the local immune microenvironment to actually reduce these recurrent, painful inflammatory flares.
It's a remarkably hopeful body of literature. We are synthesizing studies ranging from vaginal microbiomes to cutting-edge research on exosome therapeutics and mucosal inflammation.
Which is just fascinating.
It is, because what this data reveals is a massive shift in how we approach healing. It hints that the solution isn't in suppressing the immune system with these heavy pharmaceutical hammers, but in learning to speak the body's native cellular language.
I love that concept, speaking the body's language. But to understand how we actually do that, I feel like we first need to look at the battlefield itself. Let's unpack this reality of DIV.
Sure.
What is actually happening at the cellular level during one of these flares?
So, to put it plainly, DIV is characterized by chronic, severe inflammation of the vaginal lining. And this inflammation leads to what we call epithelial desquamation.
Which means what, exactly?
It's essentially the rapid, continuous shedding of the tissue.
Oh, wow. And I mean, reading through the clinical descriptions we have here, the resulting symptoms are just brutal.
Absolutely brutal.
It causes purulent discharge, intense itching, burning, and severe dyspareunia, making intimacy incredibly painful, if not entirely impossible. It just sounds like a completely fiery landscape.
That's a very accurate description.
Why does the body suddenly start doing this to itself?
Well, the sources point to a dangerous combination of two things. First, an overactive immune response, and second, something called dysbiosis.
Dysbiosis, that's a breakdown in the microbiome.
Exactly. It's a fundamental breakdown. So imagine your local environment is usually full of these helpful microbes.
Right.
But suddenly, it becomes enriched with what we call pathobionts.
Pathobionts.
Yeah, they are microbes that normally live in harmony with us, but due to some shift in the environment, they've suddenly turned pathogenic and aggressive.
Oh.
Right. And when that microbial balance tips, your immune system essentially panics.
Okay, let's unpack this, because an immune panic sounds intense. What does that actually look like in this specific tissue?
We actually have an excellent proxy for that in our sources. There's this really fascinating study looking at a similar localized immune collapse.
Oh, the E. coli study.
Yes. Aerobic vaginitis induced by an E. coli infection in pregnant mice.
Okay.
Now, obviously, while not perfectly identical to human DIV, it gives us a really clear window into the mechanism. The researchers infected the local tissue with E. coli to basically trigger that pathobiont takeover.
To see what the immune system would do.
Exactly.
Yeah.
And what they found was a precipitous drop in a very specific soothing cellular messenger called interleukin-4, or IL-4.
IL-4. How far of a drop are we talking about? Does it just like dip slightly?
Oh no, it's a catastrophic plunge. The mRNA expression for IL-4 dropped all the way down to 18.5% of its normal level.
Wow. 18%. So basically the signal just cuts out entirely?
Precisely. And IL-4 is essential because it maintains peace in the tissue. When it plummets, you have this vital communication pathway in the immune system, the IL-4, JAK1, STAT6 pathway that just gets severed.
Okay, so a severed communication line.
Yeah, you can think of this pathway as like a dedicated phone line that tells your immune cells, hey, the threat is handled, stay calm, and focus on repairing the tissue.
And when that phone line goes dead, who takes over?
Well, without that calming signal, an army of highly aggressive pro-inflammatory cells called M1 macrophages rush in.
M1 macrophages.
Right. And they act as if there is a massive systemic threat. They swarm the tissue and release this storm of inflammatory chemicals that end up damaging the very cells they are actually supposed to protect.
Okay, I think I get it. It sounds like the local immune system in DIV is like a smoke alarm that's completely malfunctioned.
Like, it detects a tiny bit of smoke from a burnt piece of toast, which would be the pathobionts. But instead of just beeping, it's like flooding the entire house with water and chopping through the drywall with an axe just to kill a single spider.
That is a highly accurate way to visualize the collateral damage, yeah.
Yeah.
Those M1 macrophages are the ones chopping through the drywall, which is what causes that painful tissue shedding.
Which is the desquamation.
Exactly. And this highlights exactly why traditional treatments for DIV so often fail or, result in these agonizing, endless cycles of recurrence.
Well, let me guess. It's because traditional treatments usually just try to mop up the water or maybe temporarily patch the drywall.
You hit the nail on the head. Traditional therapies like broad-spectrum antibiotics or heavy steroids, they don't fix the malfunctioning alarm system itself.
Right.
They might kill off the trigger bacteria, sure, or temporarily force the inflammation down, but those hypervigilant M1 macrophages, they are still sitting there in the tissue, holding their axes, ready to tear the walls down again the moment a new microscopic trigger appears. Ugh, that sounds exhausting. So you don't want to just turn off the alarm system for the entire house, because then you have no immune system at all.
Exactly. You'd be defenseless.
Right. You just want to reset the broken alarm in the kitchen. But how do we send a specific signal to do that without shutting down the whole body's defenses?
Well, this leads us directly to exosomes. They are the microscopic messengers uniquely capable of resetting that localized alarm.
Okay, exosomes. The history of exosomes in the literature is actually kind of funny to me because for a long time, scientists thought these things were literally just cellular trash.
They did.
Like microscopic garbage bags that cells used to throw away waste, right?
Yeah, it really is one of the great paradigm shifts in modern cellular biology. Exosomes are nano-sized extracellular vesicles. Basically, these incredibly small, lipid-bound bubbles secreted by our cells.
Oh.
And as you mentioned, we now know they are absolutely not trash. They are highly sophisticated care packages.
Care packages filled with what exactly? Like what is inside the bubble?
They're filled with bioactive cargo. Things like complex proteins, peptides, and unique strands of genetic material called microRNAs.
Ah, okay.
And depending on which specific cell packages them, they carry very different tools. For instance, the literature heavily features exosomes derived from specialized stem cells, like adipose-derived mesenchymal stem cell.
Okay, so stem cells taken from fat tissue.
Correct. And when these specific ADMSC stem cells pack an exosome, they load it with powerful protective payloads.
Like what?
Well, they fill it with potent antioxidants like superoxide dismutase or SOD and glutathione peroxidase. These act like chemical fire blankets to smother the oxidative stress that's destroying the tissue.
Oh, that's incredibly targeted.
They also pack in pro-angiogenic factors like VEGF, which stimulate the creation of brand new blood vessels, ensuring oxygen can actually reach the dying cells.
Wait, I have to push back here for a second.
Sure.
If they're just delivering some proteins and genetic material, how is this any different from me just taking a really targeted anti-inflammatory drug? Yeah. Or maybe a specialized hormone pill?
That's a great question.
Like, why do we need this fancy microscopic bubble to do it?
What's fascinating here is the delivery mechanism itself. Think about it. If you take a pill, that drug floods your entire system.
They're
right?
systemic.
And it often breaks down in the bloodstream or causes all these off-target side effects. Exosomes, however, offer superior circulatory stability. They are tough, and they have incredibly low immunogenicity.
Meaning your body doesn't freak out and attack them.
Exactly. It doesn't recognize them as foreign invaders and try to destroy them.
Because they're naturally made from the same stuff as our own cell membranes.
Yes, and that origin is their true superpower. Because they are native to the cellular environment, they don't just float around aimlessly like a blunt force pharmaceutical.
Right.
They possess a natural ability to hone in on specific cells in distress. When they find a target cell, the exosome's lipid bubble actually fuses seamlessly with the target cell's endosomal membrane.
Oh, wow.
And then it expels its complex payload directly into the cell's internal cytoplasm.
So they bypass all the outer defenses and just drop their instructions straight into the control room of the cell.
Exactly. And because they are delivering a coordinated combination of microRNAs and proteins, they can fundamentally alter the recipient cell's biological response in a way that a single molecule drug simply cannot replicate.
So they aren't just delivering a drug. They're basically delivering a software update.
That's a perfect way to put it.
Okay, so now that we understand what these care packages are, let's look at what happens when they are dropped directly into the hostile M1 macrophage-dominated war zone of a DIV flare.
This is where the data gets truly remarkable because we see a transition from merely suppressing symptoms to actively curing the microenvironment. Exosomes don't just block inflammation, they reprogram it.
Immune reprogramming. That sounds intensely futuristic.
It does.
But how do we know this actually works in mucosal tissue?
Well, we can look at data from other mucosal inflammation models. Our sources draw heavily on studies involving severe intestinal inflammation, like DSS colitis models. The mucosal lining of the gut and the vagina share profound immunological similarities, making this cross-referencing highly relevant.
Okay, so when these stem cell-derived exosomes enter the inflamed, fiery tissue, they specifically target those aggressive M1 macrophages, the guys chopping down the walls with axes. What actually happens to them?
The data shows a drastic reduction in the specific chemical signals those macrophages use to call for more inflammation. The exosomes effectively silence the production of M1-associated pro-inflammatory markers, things like INS and CD86, as well as cytokines like IFN-gamma and TNF-alpha.
So the fire is rapidly starved of its fuel.
Precisely.
But wait, if they just quiet down the M1 cells, aren't we back to the exact same problem? Like, we just have sleeping guys with axes in the room. They could wake up at any second.
And this is the critical pivot. They don't just put them to sleep.
They don't.
No. At the exact same time they are silencing the inflammatory signals, the exosomes force the cells to start expressing entirely different markers. They enrich M2-associated markers like the CD206 and arginase 1. They boost the production of powerful anti-inflammatory signals like IL-10, and they call in specialized regulatory T cells, or TREGs, to enforce the peace.
Okay, here's where it gets really interesting. They are forcing a phenotypic shift. It's basically cellular mind control.
Yes.
Instead of just trying to kill off the aggressive M1 riot police, the exosomes are essentially handing them tool belts and instantly reprogramming them into M2 medics and construction workers.
That is an excellent analogy. M2 macrophages represent the anti-inflammatory tissue healing phase of the immune response. In a healthy body, after an infection is cleared, M1s are supposed to naturally transition into M2s to heal the wound.
But in DIV, they don't.
Exactly. In DIV, they get stuck in that destructive M1 phase. The exosomes actively force that delayed transition.
But how? How does a microscopic bubble force a cell to change its entire identity like that?
The sources detail the precise molecular mechanism, and it often comes down to those tiny strands of genetic material we mentioned earlier, the microRNAs. For example, there's a specific microRNA strand called miR593P.
Catchy name.
Right. But when an M2-derived exosome dumps this specific strand into an aggressive macrophage, it acts like a mastile project manager.
Okay, what does the project manager do once it's inside the control room?
It activates a very complex signaling pathway inside the cell, specifically the LATS-YAP beta-catenin axis.
Okay, the LATS1-YAP axis.
Yeah, without getting bogged down in the deep biochemistry, you can think of this pathway as the mechanism that unwinds the cell's DNA. This specific microRNA physically blocks the genes that say destroy and unspools the genetic blueprints that say rebuild.
It changes the cell's fundamental task list.
It absolutely does.
If we connect this to the bigger picture, it means we're getting to the absolute root of why chronic DIV flares keep happening. The local immune system isn't just being temporarily muffled, it is being actively retrained to tolerate its environment again.
Yes, it is the active modulation of macrophage states and the entire adaptive immune network. It's profound.
It really is. But calming the immune system only solves half the problem, right? It stops the active destruction. But for someone dealing with chronic DIV, years of these flares leave the vaginal mucosa severely eroded, thinned out, and incredibly painful. Like the physical tissue itself is ruined.
Right. The riot police have been called off, but the walls of the house are still completely destroyed.
Yeah. So how do exosomes actually rebuild that physical tissue to prevent the cycle of infection and inflammation from just starting all over again?
This brings us to the second phase of exosome therapy, physical regeneration. Once the exosomes have created a peaceful environment, they go to work facilitating cellular growth, mobility, and the physical remodeling of the extracellular matrix.
There's a really specific, elegant study in our stack that illustrates this beautifully, actually. The one using an exosome hydrogel.
Yes, I'm glad you brought that up. In this study, they took exosomes derived from umbilical cord stem cells and loaded them into a hydrogel. Right. A hydrogel is crucial here because if you just use a liquid, it washes away in a mucosal environment. The gel keeps the exosomes pinned tightly against the damaged mucosal wall so they can actually work over time.
Makes sense.
And they tested this on an overreactomized rat model.
Wait, why use a rat that's had its ovaries removed?
Removing the ovaries induces a severe, sudden drop in systemic estrogen. This perfectly mimics the severe mucosal atrophy, dryness, and thinning seen in postmenopausal women, which is structurally very similar to the severely damaged tissues of chronic DIV patients.
Oh, I see.
It creates the ultimate hostile, degraded environment to test the therapy.
So they apply this exosome hydrogel directly to the atrophied, thinned-out tissue. What actually happens?
The results were staggering. The topical application significantly increased the thickness of the vaginal epithelium.
Like it rebuilt the wall.
Yes, the tissue literally plumped back up to a healthy, resilient state.
And the researchers proved exactly how it was happening. They didn't just look at the tissue, they looked at the cellular markers.
They did. They saw a massive spike in Ki-67, which is a specific protein that cells only produce when they are actively dividing and making copies of themselves.
Wow.
The exosomes were commanding the surviving epithelial cells to rapidly multiply and rebuild the lining.
But, new tissue needs a massive blood supply to survive, otherwise it just dies off again.
Which is why it's so important that the study also showed the tissue lighting up with CD31 expression.
Which means what?
It's a marker for angiogenesis, the formation of brand new blood vessels in the lamina propria. The exosomes told the tissue to build new supply lines, bringing oxygen and nutrients to the site, allowing those rapidly multiplying cells to actually survive and solidify the new wall.
Plus, they stimulated local fibroblasts to synthesize fresh collagen and elastin, bringing back firmness and hydration.
Exactly.
It's a complete architectural restoration. But reading through the sources, there's one specific part of this rebuilding process that seems like the ultimate key to preventing future DIV flares.
You're referring to the restoration of the epithelial barrier itself.
Yes, the tight junctions.
Yes, absolutely. The epithelial cells lining the mucosa are supposed to be glued tightly together by specialized proteins, things like ZO1 and occludin. Think of them as the impenetrable mortar between the bricks of a wall.
Okay.
In DIV, the chronic inflammation degrades that mortar. The barrier breaks down, allowing normal microbes to leak deeper into the underlying tissue, which is what constantly re-triggers the immune alarm.
It's a vicious cycle.
It is,
Right.
but the exosomes actively restore that tight junction architecture. They stimulate the cells to produce new mortar, preserving those ZO1 and occludin proteins, resealing the barrier so nothing can leak through.
That's huge.
Furthermore, they help regulate the local vaginal pH back to its natural, slightly acidic state. This creates an environment where the beneficial bacteria can thrive, and the aggressive pathobionts that originally triggered the panic simply cannot survive.
So what does this all mean? Like, for the listener who is suffering from chronic mucosal issues, does this mean exosome therapy is a permanent cure or just a really advanced microscopic bandage?
Well, this raises an important question, and it's vital to distinguish between the two concepts. But the data strongly suggests this is far beyond a bandage.
Really?
Yes, a bandage merely covers a wound, protecting it, while hoping the body can eventually figure out how to heal itself beneath it. What exosome therapy offers is a systems-level reestablishment of mucosal homeostasis.
Homeostasis being the body's natural, self-sustaining state of balance.
Correct. By physically closing the epithelial barrier, restoring the tight junctions, balancing the pH, and fundamentally reprogramming the local immune cells to maintain peace, exosomes stop the microbial leakage that drives the chronic DIV cycle.
They address the structural damage and the immunological root cause at the exact same time.
Exactly, and they offer a profound, non-hormonal therapeutic strategy. For patients who cannot take estrogen due to cancer risks, or for whom traditional steroids have just completely stopped working, this is an entirely new avenue. It leverages the body's own regenerative capabilities.
It represents a fundamental shift in medical philosophy, really.
It does. We are moving from blunt pharmacology to precise regenerative medicine. We're no longer just blocking chemical pathways. We are providing the exact biological software updates the tissue needs to repair itself from the inside out.
Let's distill this deep dive for a second. We started with the fiery, destructive landscape of DIV. An environment completely dominated by hyper-aggressive M1 macrophages acting like a broken alarm system, just destroying the local tissue.
Right. And we then explored how exosome care packages, loaded with precise microRNAs and protective proteins, can hone in on those specific immune cells.
We saw how they reprogram them,
Yeah.
taking them from destructive riot police and shifting them into healing M2 medics.
Yes. And finally, we learned how these same microscopic messengers command the tissue to physically rebuild the vaginal barrier, stimulating cell division, new blood vessels, and resealing the tight junctions to restore total local balance.
It's an incredible paradigm shift. Whether you are dealing with chronic inflammation yourself or, you're just fascinated by where medical science is heading, the future isn't just about suppressing the body with heavy drugs.
No, it's about learning the body's native exosomal language to command it to heal itself.
It is a deeply empowering way to look at human biology. The tools for healing are already written into our cellular communication networks. Science just had to learn how to package and deliver the message.
Absolutely.
And speaking of delivering the message, I want to leave you with one final, slightly mind-bending thought to ponder that builds on what we've talked about today.
Oh,
Yeah. We focus heavily on exosomes derived from human stem cells. But our sources mention something totally wild. Plant-derived exosome-like nanoparticles.
yes. The cross-kingdom communication data. It is fascinating.
It's incredible. Studies are showing that exosomes from everyday plants like ginger and garlic can actually survive the human digestive tract.
Yes, they are incredibly robust.
They're tough enough that they don't get completely destroyed by our stomach acid. And once they reach the gut, they can fuse with our cells and actively alter our host bacteria, promoting healing and reducing inflammation.
Which opens up a tremendous realm of possibilities for systemic therapies.
Exactly. So if these cross-kingdom exosomes can survive our digestion and reprogram our gut microbiome, could the future of treating localized inflammatory conditions like DIV involve simply engineering the food we eat?
Oh, wow.
Like, could we one day deliver vaginal immune reprogramming exosomes directly through our diet? Imagine biting into an engineered apple that systematically turns off your body's broken smoke alarms no matter where they are.
Now, that is a truly revolutionary concept for the future of regenerative medicine.
Definitely something to chew on. Until next time, keep diving deep.